This original WSRE presentation is made possible by viewers like you. Thank you.
Understanding addictions. Many people don't. How and why does one become addicted? It's a complex topic, one that we'll be addressing with a panel of addiction experts in our show, Pathways to Hope. In Studio begins right now. Well, it seems as long as there have been humans, there have been addictive behaviors. Both nationally and locally, addiction seems to be a growing problem. Now, having said that, there's hope, and that's where our broadcast comes in. Several experts, all working in the field of addictions, are joining us this evening. We welcome to our roundtable discussion tonight Meg Doherty. Meg is an addictions and mental health counselor. She earned her master's in professional counseling from Grand Canyon University and has worked in a variety of settings, including outpatient, inpatient, and residential. As with the others, her clients are diverse in age, race, diagnosis, and severity of symptoms. She works at the Friary and is trained in a variety of addiction therapy modalities. Meg is also in recovery, so she brings that perspective to the table as well. Bruni Emanuel has a master's degree in counseling and human development. He's designed, implemented, and managed addiction treatment programs for over 40 years. Bruni is currently director of the Men's Residential Treatment Program at Pathways for Change. Kevin Moser. Kevin holds a master's degree in clinical mental health as well as a Bachelor of Science in Theology from the University of Notre Dame. Now in private practice as a family counselor. He's also worked as a therapist at Lakeview Center and been a missioner in Santiago, Chile. I just love to say Chile. So there you go. Glad to have all of you here with us. So what I would like to do is introduce the audience to you a little bit more personally and just have you tell us more about how you get from where you were to right here today. So Bruni.
Well, I'm a local person. My family's been in the area for a long, long time, and I was at Spring Hill College in undergraduate work in the 60s, and I became a conscientious objector and had to do something as alternate service for the government, and I started a program for heroin addicts coming back from Vietnam, and basically I've been involved in the field ever since.
So did you just see that need and say somebody needs to do something about this, and it wasn't really being addressed?
Well, there wasn't much treatment in the 70s. That was sort of the beginning. In fact, there's a fellow here in Pensacola, John Daigle, who started a therapeutic community in Pensacola the same time I started one in Mobile.
Wow, so that's been going on. Well, we'll get back to all of that. But Kevin, how about you?
Well, I have a master's in counseling. This is a second career for me. I taught for many years English and Spanish down in South America, but I've kind of found what I've always wanted to do, what I love to do. I'm also in recovery. I have 6 years, part of the NA, the Narcotics Anonymous Fellowship. And this past year I've been doing private practice. And I work with some clients that are in recovery or in active addiction, but I also see a range of folks, families, individuals, both in English and Spanish in the area, and I'm really enjoying it.
We're so glad to have you here with us this evening. And Meg, how about you?
I have been in recovery for almost 14 years, and this is also my second career. I was in financial services and insurance. And when I decided to go back to school to get my master's in counseling, it was really, I wanted to work with military families. That was sort of what brought me to the field. And the two populations that I knew for sure I didn't want to work with were children and addicts. And
so much for that.
The only two populations, for the most part, that I have worked with are children and addicts, and I love it. I have just found my calling, and I love working with people who are trying to get their lives back.
I am so glad to have all of you with us this evening, because how perfect is that? If you have not experienced addiction or problems, you might not be able to be as empathetic. Would you find that to be a true statement?
Absolutely, because oftentimes there's such devastation to everybody who surrounds the addict that it's hard to be empathic.
All right. So let's talk about what we're talking about when we talk about addiction. It's called so many different things these days, but what would you call addiction, and how would you say that it's maybe changed through the years?
I'm not sure if addiction has changed that much. The substances that are abused and the behaviors that are compulsively done may have changed, but addiction as itself, I don't believe has. And to me, addiction is much more complex than the substance. One starts showing, it affects the whole person, body, mind, and spirit. And so one starts showing behavioral change before you actually get to the point of using the substance. And we can talk more about signs and symptoms later if you want.
Sure. No, we're going to definitely want to do that. But when you think of addiction, Kevin, what do you think of?
My mind goes to a lot of different places. I think it's good to clarify that we're talking about substance, or the use of substances in addiction, because oftentimes addiction can. We talk about other types of behavioral addictions. For example, gambling. It can go from gambling to food to shopping. So it's good to separate those out a little bit. I think substance addiction, and that includes alcohol, is its own
area.
Thank you. And I kind of mentioning what Bernie mentioned, that obsession and compulsion. Once we begin using a substance, and what we call the true addict, there is that difficulty in stopping, and there's a progressive use and abuse of the substance where it almost takes over, kind of that compulsion to use. And I think that's different, maybe, than talking about some of those other behavioral addictions. This is a really specific issue.
Sure.
Well, and it's interesting that the root word of addiction comes from the Latin word to enslave. So if you think about addiction as having your brain hijacked, in true active addiction, there's a tremendous sense of a loss of control to avoid the behavior. So that really flies in the face of what for years I think we looked at as kind of a moral failing. Why can't you just stop? And it's, for the true addict in active addiction, they're no more able to stop than somebody who hasn't eaten in 6 days to be confronted with a cheeseburger and say, oh no, I'm vegan. I mean, your biological need in that hijacked brain says, at all costs, at all costs.
This is what you will have. At the root of it all, though, surely there's something at the root of human behavior that comes into play when then you look at compulsive disorders and then moving into addictive. You said it sometimes can be years and years and years before the actual substance abuse comes into play. What are your thoughts on that?
Well, a couple. Number one, I have a friend, Judith Landau, who's been doing research in this arena for a long time. And Judith proposes that all addiction follows trauma, whether in my generation or in the previous generation. And if that generation didn't deal with the trauma, it's going to show up in my generation, and if I don't do it, it'll show up in my kids. So that's one of the things, is a history of trauma somewhere. And I believe there's a biological,
Marker?
kinetic way that a brain's addict works different than an abuser or social user.
And how that's got to be so hard, because people are very adept at making excuses, are they not? How do you tell somebody that truly wants help, and most people, there still are stigmas attached, don't want to come out and say, I'm using these substances and I can't stop. What do you do?
One of the as a recovering addict and somebody who deals with this on a regular basis, one of the sayings that really just spoke truth to me was, you know, I'm not responsible for my addiction. Kind of saying, you know, kind of tying what Bernie said. Addicts often talk about that aha experience. You know, I've taken that drug and I feel incredible and wonderful, and so I'm not responsible for the addiction. I am responsible for my recovery when I learn what recovery means. That's a big step, because I think oftentimes, right, you know, people that aren't, you know, what we call maybe classic addicts or have that experience can use and go back and do their, you know, go to their regular day, and addicts want to come back and it gets worse. So that, you know, recognizing that the disease part, I totally agree with Bruni. That's been my experience. There is something different, genetic. There's a medical component there, but we can be responsible for working towards recovery and trying to be without substances.
And owning it, yes.
Absolutely. We're testaments to that. If it was a preordination that there is no hope, nobody would ever recover. Nobody would ever get clean. So that medical kind of disease model has to be balanced with an element of choice in the face of a disease that tells you you're not sick, day in and day out. So the battle that we fight in the addiction treatment community is to kind of use Socratic questioning to get the addict or the alcoholic to answer the questions in a way that might reveal something that they haven't been able to identify yet. Because the truth is, everybody in their life can tell them that they have a problem. They can lose job after job and have relationship after relationship fail, and they will still find ways to make it about everything but the substance, until hopefully they get to a place where all roads lead back to the right answer.
Do you find in this type of thing where you actually get to work with people, have they hit the bottom typically, or will somebody come that has not hit the bottom?
Yeah, well, the bottom is an interesting concept, and I'm working within the Escambia County penal system with people who have hit a bottom or a wall.
One of them.
They are, the Pathways for Change program deals with men who've been adjudicated guilty of a nonviolent drug-related offense, and they have a long 18-month program that they have to go through. But understand, recovery is not quitting the substance. That's just putting the substance down.
Right.
Addiction has to do with all these behaviors that precede and postcede, if that's a word, the actual use.
Right.
And it's those things that need to be really clarified and straightened out in the self-questioning process.
Right.
And that's what the 12 steps of AA and those fellowships, that's what they do, is walk you through that.
So, just again though, difficult to say, do you feel like, and we've just got about a minute till we go to a break, but do you feel like when we classify this as a disease, does that give some people an excuse, maybe?
Sure.
Because then we're kind of on a ground like that.
Oh, I think so. I think the way that it's positioned is really important, because there are, you know, in addiction, you want reasons to continue because all roads lead to dopamine. My brain wants the dopamine,
Right.
and we'll probably get into the brain chemistry. But certainly, you know, it's like you tell somebody that relapse is a part of recovery, and there are some people that are going to hear that as permission to continue
Right.
in the behavior.
Right.
Is it true? Yes. Is that necessarily a helpful position? I don't know. I guess it depends on who you're talking to. It is a very complicated, it's a very complicated beast.
We will take a break and we'll come back and go into that, delve into that a little bit more. So when we return, we'll continue our discussion of addiction with our panel of hopeful and helpful addiction experts. You're watching in studio on WSRE. We'll be back in a moment.
Unlock your newest member benefit. Over 1,000 episodes of your favorite PBS shows. American Masters, Antiques Roadshow, Nature, Nova, Masterpiece. Watch the best of PBS anytime, anywhere. Become a member, sign in, and start streaming today.
Welcome back. We're continuing with In Studio. Tonight's topic, the many aspects of addiction and recovery, the pathways for hope, if you will, that are available for addicts, their families, and society. So I want to thank all of you for being here again. What do we see when we see an addict? Does everybody see something different? We'll start with you, Bernie.
I think the first thing that we often see is a suffering family. But the behaviors that the individual manifests, I think, are best encapsulated in three things. One is a compulsion. It's an irrational urge that the person just can't control. Number two, there's loss of control. They can no longer predict when, where, how much I'm going to do this. And the last one, I think, is the most important, and that's that you continue to use the substance despite the fact that everything in your life is telling you not to. So, compulsion, loss of control, and continued use despite negative life consequences.
Right. It sounds so overwhelming. It's like, as therapists, how do you even, when you have somebody that has this, how do you even, Kevin, you were mentioning being able to delineate maybe the severity of an addiction.
Oftentimes, I think when someone comes in for counseling, oftentimes they're not necessarily a willing participant. They may still be in denial. And their families are pressuring them in. So it's important to know if the client who comes in to see you is in active addiction or has had some recovery and is, if they're in active addiction, you need to make a connection and let them know that you're concerned. And there's a bit of psychoeducation involved, and letting them know how addiction affects their lives, and giving them a sense of hope that there is a possibility of living a different way. I think often when people are in active addiction, they don't feel that there is an alternative. They're so consumed and obsessed with getting and using the drug that they lose a sense of hope. So that's very important to communicate that, and maybe separate the person from the addiction and talk about it. So that they can realize that they're not being judged as a person, that this is something that happens. They're not alone, that it's a common factor.
Right.
That's a really important point. I look at addiction as a symptom of another problem rather than the problem. Now, is it a problem? Clearly it's a problem. That's typically what brings people into the Friary for treatment. But if we can distill it down to what it started as originally, and you referenced this as it being, kind of rooted in trauma in many, many cases. I also know that there's programs that look at addiction as an attachment disorder. There are things that go back to early childhood and lack of proper attachment. But if you're able to say, despite all of this, your use of this drug or your use of this alcohol is perhaps what kept you alive to get you into this office, sitting in that chair across from me today. Thank God you found that.
Oh, wow.
Thank God you found that. How did you know to do that? Because it kept you alive when maybe had you not had that, you might not be alive. Do you think they ever thought about that?
No, I've never thought about that.
As a resiliency trait. And so that can be the thing that maybe helps them think about it as less of a character flaw and maybe a source of strength.
Wow, I'm resilient.
Yeah.
Interesting.
Yeah.
That's very interesting. And you see, you were saying you see so many different degrees. It's just, I would imagine it really takes a person wanting to get some help, even though sometimes it is the family bringing them in, or even they may be there against their will.
Yep.
At some point, somebody has to own it somewhere, right?
Right. And oftentimes
Yep.
it's the family that owns it before the addict.
Yep.
You said something I find very interesting, because someone was telling me that DNA obviously is passed down. We might get the same color eyes, we might get the same color skin, or we might, but people oftentimes don't think about brain DNA being passed. So somebody's grandparents had some kind of trauma, and here's this person. Again, you don't want to not have somebody be accountable for it and say, oh, well, it's not your fault, your grandparents' fault. But how important it is for them to identify that.
Yeah, for the individual, it usually takes quite a while before they're able to get to that root that Meg's talking about, because it's well hidden. I've been doing behaviors, I've been using substances to mask it from myself. Trauma is a horrible thing that we're just starting to understand. And my friend Judith that I referred to earlier, she would propose to you that trauma causes DNA change.
Wow.
That trauma, and what we think of as an emotional experience, causes physical change.
And that's where it all.
I'm so glad you brought this up. I read an article yesterday where they isolated DNA from a person, put it in a container in another room, and then brought about an emotional reaction in the person and compared the energy from the person to the energy in the DNA in the other room, and it was simultaneous and identical.
Wow.
There's empirical evidence that says trauma changes, that emotions change our physical DNA structure. So that's going to change the conversation that we have about addiction, and hopefully the way that we treat it and the way that we talk about it as a community. Because it, for all of the progress we've made, we still really talk about it as a moral failing. And there is still stigma attached to it. And there's stigma attached to getting help. Why can't you just do it yourself? Why am I going to spend 12 grand for the third time sometimes? There's just not a part of the family or community that isn't affected by this.
But none of us would be here were it not for the fact that recovery is possible.
Amen.
Right.
Yes.
I mean, that's what we do, and we do it because we love it, because we see
Right.
lives and families change.
Yeah.
I'm working
Absolutely.
with third generations of families, and it's that change why we do it. So recovery is possible, and there is hope.
On a personal level.
Yeah,
sorry,
that's
I just wanna-
important. I was going to ask Kevin too, and
Yeah.
keep whatever thought you had, but I was going to
Okay.
ask you too, how do you recognize somebody that, what does it look like?
Yeah, I was just going to share on a personal level, as someone who struggled with alcohol and marijuana a good bit. I have a 24 and a 22-year-old son, and I see some patterns in my grandparents where there was a lot of drinking. Not to mention the Irish, but with my boys, I sit down and we talk openly about drinking and smoking pot. And I tell them about the family history, and sometimes it's hard to understand that idea of a genetic predisposition. But I know my own substance use became a problem when I was under a lot of stress. I mean, they were being born and working on a master's and working full time, and having that in my background, and then living a lot of personal stress, and how that manifested itself. And looking at that and being able to share that with my boys and say, these are things that you need to be careful of. And having that communication where they can openly talk about, Dad, we're smoking
So
pot over,
huge.
just having that communication and letting them know that this is part of your genetic makeup. I hope you do it a little bit better than I did, and I hope I can be with you during this process.
Well, and
It's been
again,
helpful.
it's not license, right? It's just let's give you some background and
Yes.
Right.
help you recognize.
Information is power.
Right.
Yeah.
Absolutely.
When I look at the people that come in to the Friary, the first thing that you see is pain, and sometimes the pain is much more evident on the family's faces. Sometimes because the person that is coming in for care is actively impaired, and they don't, they feel
care.
okay right now.
Yeah.
it's just such pain and it's such despair. And this didn't arise 5 minutes ago. This is a battle that this family has been fighting for a long time, and they still hope. I've had clients that have been in 13 different treatment centers,
Wow.
and they continue to fight for their life. And there's just something so remarkable about that. There's something so courageous about addicts trying to get help that is amazing.
Yeah, and when you talk about third and fourth generations and the pain that is there, is it possible for somebody to break the cycle in this family?
Absolutely. And the interesting thing about, quote, intervention is we always thought that you had to intervene with the primary addict because a family is a system, and what happens to part of it affects all the other parts of it.
Right.
You don't have to intervene on the addict. You can intervene on mom, who's letting him do what he's doing, or spouse, or children.
Yep.
To change the system. And that's what I think we're all trying to do.
Yep.
Not just help the person, but to help the system.
Well, and as a system, and you're talking about the new things we're learning, the DNA is energetically acting over here the same way it's acting over here. I think someday we'll probably look back on this discussion and say, wow, that's so antiquated. And at the same time, you're saying there's hope. So we're getting there. Let's talk about some of your success stories that you've seen. I mean, we're going to get to that much more later, but I mean, you're seeing some success and improvements.
Absolutely. I have, in fact, I'll share with you, I got a phone call 2 days ago from a client that I treated in Colorado, and she came into a program that I was the clinical director of, very similar to the Friar. It was about a 30-day program. She came in at age 59, having been a lifelong alcoholic, and she just was accepted into a master's program. She's about, she's just about 15 months sober for the first time in her whole life, and she's in a master's program in grad school, has reconnected with her family, again, large Irish Catholic family, and her life has changed. Her relationships have changed. And she still calls me from Colorado about once a month just to check in and say hi. We don't get that information very much. We don't, it's hard to follow our clients, and unfortunately, the success stories seem to be rarer than the struggles.
Talking about addiction, and have we talked about, and we've just got about a minute here, the difference between addiction and abuse? Yeah, I'd love to hear what you think.
Sure. I was just thinking and kind of reflecting on some of the things that I've heard. We know that I think it's good to think of it on a spectrum, and we're kind of moving towards that in mental health, to think of it, there's mild, moderate, and it can get progressively worse. At the same, and to remember that this is a disease that affects people when you're struggling in personal relationships, in work, and you continue. It's so powerful that you continue to use substances even when your life is falling apart. I mean, that's how powerful this can be. So the message of hope, and we haven't talked about 12 steps and support, but that message that there is a different
way to do it.
Different way to do it. And it's accessible and possible is so powerful, especially when you're caught in that addictive cycle. You really feel there's no hope.
Right.
So.
Well, we've thankfully got 30 more minutes for this broadcast because we could talk all day. So we're going to take a quick break, and you're watching in studio on WSRE TV, PBS for the Gulf Coast. And when we come back, we'll continue this discussion on addiction. Stay right here.
Join WSRE at Gulferia Marine Adventure Park for PBS Kids and Family Day, Saturday, March 11th from 10 a.m. to 2 p.m. Meet your favorite PBS Kids characters, enjoy crafts, a scavenger hunt, a bounce house, and discover all the fun that Gulfarium offers. See the dolphin and sea lion shows and explore the animal exhibits and aquariums. Bring your cameras, bring your kids. Don't miss it. Saturday, March 11th at Gulferia Marine Adventure Park in Fort Walton Beach on Okaloosa Island.
This is In Studio on WSRE TV. We are talking addiction and pathways for hope. Our panel includes experts that are working daily in this field. So we're going to talk more now about treatment options for those individuals affected with addiction, as well as help for their families. And we've said it once or twice or three times, everybody's affected, not just the person that is using the substance. And it's a big symptom of a much bigger problem, but we do have a continuum of services.
We do.
Bruni's going to share that
Every
with us.
community has a continuum, and of all the pieces in the continuum, for example, one of the service types is called intensive outpatient. So instead of going to residential treatment, you go to a particular place with a group of people a certain number of days a week, hours per day, and you get a lot of the same benefit that you get in residential treatment. A community may not have intensive outpatient program, IOP. It might have residential and it might have outpatient, but not that slice. So the continuum goes all the way from education and prevention services through early prevention services, early intervention, formal intervention, outpatient, residential, locked up residential, and then you start getting into the recovery support services, including recovery housing. So there's a whole continuum, and the science has developed a great deal over the years, especially as a result of the work of the American Society of Addiction Medicine, ASAM. They have developed something called patient placement criteria. So they're able to look at a person and look at the various domains of their life, evaluate those, and come up with a placement for that person based on those things. So there is a science. But the main thing is that if I'm a husband of an addict using wife, all that science doesn't mean a lot. What means a lot is for me to get hope and to be able to help her get help. And thank God there are a lot of options in our community.
And so how do you start? How do you start? Where do you start?
It depends. I mean, I think if you're a family member with somebody who is resistant or reluctant or just not ready to make that self-discovery piece yet, the place for family members to start might be Al-Anon. It might be getting online and finding an Al-Anon meeting. Al-Anon is a great support system for the family members of people that are struggling with addiction, for them to understand how to take care of themselves, because that family piece is so critical. And if I am busy caring for an addict, I suspect I'm neglecting myself. I'm probably neglecting the rest of my family. But the other thing is, Bruni, you mentioned a resource that I'm a little embarrassed to say that I wasn't even aware of. So I'm going to tell us about that again.
There's a help line. Just all you got to do is pick up the phone and go 211, and you go into a group of people. There's actually people on the line, and there's a database of information and resources for just about anything you need, including addiction and mental health. So if you got an issue and you want to know what's the help available, just dial 211 and ask them.
So it's like information for anything?
Basically anything.
Pretty much?
And they can do it by zip code or topic, you name it. Try it.
And
Wow.
you can Google, you can get online and Google any permutation, combination of addiction recovery services, and you can find what is available in your community. I think we're fortunate in this area that we have a pretty deep and broad base of resources here across the Gulf Coast. Certainly Lakeview Center has a lot, from inpatient detox, medical detox, all the way to outpatient services. We have, private therapists. We have, the Friary does really good work in a very small, intimate setting. Really low staff to patient ratios that we can really fine-tune and individualize treatment services. Pretty much, there are services that can meet the needs of the family and the addict, meeting them really wherever they are.
And who pays for this? Because I can hear people that are watching tonight saying, but I can't afford that. Yeah. And I'm hearing people that are saying, but my family just don't want to have the stigma. I don't want anybody to know that we've got any problems. Is this pretty much like, the martinis and the cigarettes in the 50s, right? My Mad Men reference I wanted to use there. I got it out. But I mean, really, that was swept under the rug so much. Is it still?
I can say, well, I'd make a little plug for 12-step programs, which has been a big part of my own recovery. They're free, they're anonymous. I think, and they're effective. Especially the addict often is isolating and feels that their addiction is different than everyone else's addiction.
All day long, I
classic.
hear that. Yeah.
So, there's a big stigma with this disease, and part of the disease is the family and the addict hiding it from other people. So it's scary to come out and look for even. 211. That sounds like I'm also. And
well, I just
that's
learned
here.
about it too. Right.
But what a beautiful thing to be able to call and be anonymous and receive that kind of support, which is huge. It's scary to be able to come out and say. In my private practice, I won't not see an addict for money reasons. So I think some of us. I say that because. If a person is in need and wants to seek out help, that's my commitment, and it's a chance for me to give back. But the 12 steps, there's a reason why they're effective, and they've been around for so long. And there's a beauty and there's a wisdom in that collective experience. I'm amazed hearing Bruni being involved 40 years in this. And the steps have developed, and they're there. And addicts, and I'll speak personally, we think we're different than everybody else, and we're not. And being involved in these groups is a way to remember that we share, this pain, and we choose to use substances because we're hiding from other issues and trauma that we haven't dealt with. So I'd make a plug for that. And the scariest thing is walking through that door the first time, and once you do that, you realize I'm not so weird, and there's a ton of people that have come through these doors and found hope.
And addiction is the great equalizer. We see it where we'll have, I'll have a federal court judge. I went through treatment with, a federal court judge, and we'll have pilots, and we'll have people that were maybe a step away from living in a dryer box under the bridge. And we go to the same groups, and we have the same addictions, and we talk about the same things. And it truly is the great equalizer. That being said, treatment isn't equal. It does take resources to get to get certain kinds of help. And despite all of the science that says 90-day treatment programs produce the most success long-term for achieving and sustaining recovery, it's almost impossible to get insurance to pay for a treatment of that duration. Not impossible, but it's very difficult. So, it's kind of constantly this battle for valuing the work that we do in addictions and the money that we've spent on our education, and also wanting to do what you described, which is help addicts recover.
Right.
On the financial thing, one of the great hopes that I see happening is that there's legislative movement toward integrating behavioral health with regular medical help. Okay? So I go to my doctor, he's a primary care MD, but if I have a psychological problem, in theory, he's plugged into a network that has counseling and these other services. And it's called parity for insurance, that more and more insurance companies are being required to pay behavioral health, which is mental health and substance abuse, on parity, on equality
Right.
with primary medical health issues.
As they should, because is it not true that a lot of times those, yeah, I mean, it's better to get some help for that than to have surgery or develop another disease, right?
Absolutely.
It's gonna show up somewhere. Is that
right.
correct?
Right. And and then you get into the debate about the disease model, and when you've got, because there is an element of choice. Once somebody finds a measure of recovery, there is an element of choice in relapse. And so the question becomes, from a financial perspective, if this company is paid for one person to go through treatment 7 times, at which point do you say, look,
Right.
this has got to be something that you own, because we're throwing good money after bad. Unfortunately, there's no balance there yet. It kind of seems to be an all or nothing. We've got people that have been through treatment multiple times, and one person who clearly meets the ASAM criteria, and their insurance company says, yeah, no.
But society is paying for it one way or
You can
another.
count on that.
Absolutely.
The men that I work with within the penal system, the likelihood of their children going to prison is 4 times higher than if their father was not in the penal system. We live culturally within our little microculture and the next culture, the religion or the whatever, and Pensacola and Florida and Christian or Muslim or whatever. And what addiction affects all of those pieces. But again, I want to go back to the main message of hope. Remember, a family is a system. We used to believe you had to intervene with the addict in order to get the system to change, and you don't. I'm telling you folks out there, you don't.
Yeah.
You can intervene anywhere in the system to change the system. It might not happen overnight, but it's going to happen.
I've heard it said that when one person gets well, everybody gets well.
Addiction's contagious, and so is recovery.
Yeah. So it's you said it's the great equalizer. We're saying it's a humanity's problem. It's societal's problem. Is there a bigger picture here that everybody is looking to get to, that they're hiding these fears?
I'd love to be able to have a show and a conversation about the spiritual aspects of addiction and recovery, because remember, it affects your body, your mind, and your spirit. And it's in that spiritual realm where the deepest part of recovery happens. Whether you believe in God or not, that's not the point. Whether you go to a church or not, it's a spiritual illness, malady.
It absolutely is. And for many people, that's the last piece to be addressed, because it is the one that gets the least attention. But for many people, and I'll speak about my own recovery, it was the last piece put in place. It was absolutely, without question, the most critical piece for sustained long-term recovery and integration of who I am into a life that was fulfilling. And that would not have happened without owning that spiritual piece, because addiction creates a spiritual barrier between the addict and not just their God, the God of their understanding, but the people that they're connected to. It's incredibly isolating. And everything that we know about addiction is, in fact, Johann Hari wrote a book called Chasing the Scream, and he's traveled 30,000 miles discussing addiction all over the world and trying to figure out how we can combat this. And he identified the opposite of addiction as not being sobriety, but the opposite of addiction is connection. And I truly believe that it is.
Spiritual
Just
health.
truly believe
well,
that
I'm
it
going to
is.
take Bruni up on that suggestion
All
for a
right.
whole,
All right.
whole
I like that.
hour on that. But we're going to take a break right now, and you are continuing to watch in studio. We're on WSRE TV, PBS for the Gulf Coast, and we'll continue with tonight's topic, Pathways to Hope, right after this break. Welcome back. This is In Studio. Our guests this evening, all experts in addictions, all seeking to help others in our community and to help us understand more about addictions and how we are all affected by this societal disease. And we're talking predominantly about alcohol, drugs, and all of that, but there are so many things that people become addicted to. Yes? You see different things. This is just the one that seems to be hitting society so hard, because then there's a car wreck, or then there's a hospital stay, or then there's a family that's torn apart. But
there are oftentimes a single addictive pattern doesn't exist in isolation. There's other addictive patterns that surround it. And I want to go back and emphasize one of the points. If alcohol is my problem, and I'm able to put alcohol down, I can still have all of the other addictive behaviors. And that's what needs to be dealt with, not just abstaining from the substance, but the crazy thinking, emotions, and relationships as a result of that pattern.
And so those addictive behaviors would be what? Give us an example.
And what I see, I'm inside the county work release center with 28 men. And so I see a man who is starting to get nervous about things. And to me, that's a sign that, because I know him, that he's moving in the direction of a particular outburst or behavior. And that's typical across the line. These folks who work daily with addicts, they know, and you work with the family members, so you know, and you'll see it in the family as well.
Right. Oftentimes, thanks, Bernie, for the lead-in. But oftentimes, we're working with, I'm working with the person working with the addiction, but I'm seeing some of the family members, because they're dealing with some of the poor choices they've made to protect the addicted family member. And we find that we take certain roles, kind of the, whether it be, the funny person or the person that covers up or the perfectionist. So it definitely affects the whole family members. Another quick point, an hour of counseling once a week is not enough to deal with. That's why it's so important that the person in active addiction is also seeking support in the community, whether it be 12 Steps, and the family. Meg mentioned earlier about the importance of the family getting that family support that they need.
Yeah, well, Meg did mention that. She mentioned something I think is very interesting, and it's the free nature and the things that we didn't have 30 years ago, and that is Google. Getting the right information. Right, yes. I heard there's an app for this in some of my studies. Doesn't AA have an app or something now?
You can download the Big Book on your phone. Yeah. There's all kinds of resources. Like Bruni said, the problem isn't the problem. The problem is a symptom of the problem. So you take this away, and I'm still left with an inability to experience moments of physical or emotional discomfort. I don't know what to do with that. I haven't felt an emotion in so long that I don't know whether I'm happy or sad or frustrated or angry. It all feels icky. And that has to be dealt with in a therapeutic way, or I'm going back to this, because this is always going to be on the table for me, whether it's alcohol or heroin or marijuana or compulsive sex or pornography or ho-hos. I mean, the compulsion is going to be there, because all roads lead to dopamine. And if I can't stand to be present in my life because it's awful, and I know something will give me that burst of pleasure, even for a moment, even in spite of the knowledge that I have of what this is going to do to my greater life, because I've experienced it before. If I can't stand to be present, I will go for what is going to give me some relief, even if it's for a moment, and even if it's going to wreck everything.
Well, this sounds like the human condition, basically. And so we're talking about hope. hope for somebody that can't stop eating chocolate cake. Hope for anybody that's got something that is like that. Where do people begin to replace those behaviors that they know are going to make them gain weight, or the exercise is going to make them too tired to do anything else, or the porn's going to break up their marriage, or whatever it is? Where do people put that?
It's got to be holistic. Remember,
Yep.
addiction affects body, mind, and spirit.
Right.
And so a man in our program who's doing well, we'll see him learning things in his brain that he hasn't done in years. We'll see him physically taking better care of his body, and we'll see him getting clear about what his relationship is with that great one that we call God, mostly in our country. That you'll see recovery begin, a little nascent seed of recovery begin to take place in all of those sectors.
And you see oftentimes the very worst of it, but if it's a societal problem for every person that's out there, how does that work for that person? Because that sounds like a big job to fix body, mind, and spirit.
Go to somebody that's done it. I mean, that's the beauty of AA and NA. If I'm trying to figure out how to lose weight, I'm not going to go to somebody that has 80 pounds to lose. I'm going to go to somebody that has done it successfully. If I want to know how to live a life of recovery, I'm going to go to somebody that knows how to do it. And I'm telling you, when I was in treatment, if they would have told me the only way to stay sober was to put a clown nose on and wear a grass skirt, you can be darn sure I would have been walking down the street with a clown nose and a grass skirt on, because I trusted that the person who was giving me the information knew what they were talking about. If you want it, go to somebody that knows. Go to somebody that knows, that you trust. And if you don't know anybody, ask somebody.
Sherry, I think it's important to recognize that this disease is not a cookie cutter, one size fits all. We all have emotional triggers, and we need to. One of the things that we work on in recovery is recognizing each individual, having a person recognize their emotional triggers. What is triggering them to go to this poor choice? We also know in active addiction, we put all our development on hold. I mean, when we're talking about the spiritual, the social, we give up all those things because we're chasing this terrible decision, and we don't know how to break out of that. So it's kind of starting over and going back to maybe to where you were in your developmental process, and growing up a little bit, and
That's good information for the families too, to understand that when you start using drugs at 14 or 15, your frontal cortex, which is where all of your higher reasoning, your executive functioning, your judgment, your decision making, that's where the drugs go. So we talk about arrested development. That's literally what happened. You may be dealing with a 35-year-old, but you're dealing with a 14-year-old emotionally and developmentally. And those are the choices that we see are much more akin to an adolescent rather than somebody that is well into their 30s, but that's because their judgment and their higher functioning kind of stopped developing at the age that they started to continually use these substances.
Just so much to talk about. Somebody said, well, why don't you talk about how marijuana plays into it? I know there are drugs out there that help people get off of other drugs. There are so many aspects. The law is getting involved.
Opiates are a very beneficial thing in our society, and they're killing people like crazy. So you can have something that's good and they can have a bad result at the same time. And a lot of us aren't able to bring that into our mind. It has to be good or bad. Not so. The reality is, it's good and it's bad.
And there's a lot of medications that they're using now to support therapy. We're seeing, we're using some opiate replacements that are incredibly successful in helping people manage opiate addiction and withdrawal. The use of antidepressants when your brain chemistry is all out of whack because of years of addiction, but there is still that overcoming the perception that I'm trading one pill for another, even if it's an antidepressant. So there's just a lot of, it's a really complicated issue.
It is, and you
really
used the word trust. I think that's a huge part of the thing is trust.
Yes, it is, and it's directly related to hope. I think trust and hope are joined at the heart.
Oh, I like that. I like that.
I think you're absolutely right.
And there is hope, because I'll tell you what, my definition of mentally healthy is happy. And the further I moved away from my addiction, the happier I got. And it doesn't mean I'm, this Pollyanna that doesn't have bad days, but generally, life is good. Yeah. And that's really what I want for my clients.
That's what we want for everyone, and that's what everyone deserves.
And their families.
And as we're moving to the end of this show, I want to formally thank you.
Oh,
Because so often this is so painful and scary that we don't do this, what we're doing. And I want to thank you.
Oh, well, thank you, because you have the knowledge. I'm just able to facilitate you lovely people coming on and sharing this with us and helping to lose some of that stigma. Do you think we're making strides there as people who are recovering yourself? And I've also often heard it said that once an addict or addicted or substance abuser, always. Is that, but that's just everything, it sounds like to me, right?
I believe that. I mean, I believe that. I think you're either working a recovery or you're working toward your next relapse. In my mind, that's been my truth. But I certainly feel like there's value in people saying, seeing successful people in recovery that can come out and say, I am a recovering addict. And that doesn't define all of the aspects of me. It's one very, very small part of who I am.
And so what? We support you, right?
That's
So I just, final thoughts. I've got 30 seconds.
I just want to thank you and thank our other guests. Y'all did a great job. Thank you.
I appreciate it. And
I'm
as
really
we
honored
said,
to be a part of this panel.
Just want to share the message that there is hope and you're not alone. And coming out and talking about these issues brings hope to others. So don't make that effort to look for services
and they're
you're not
everywhere.
And remember, 211.
211. I'll remind everybody about that again. That's
211.
great
I like
to
that.
know.
I know.
That's really great to know. Well, thank you,
Thank you.
all of you, very much. And we will
Sharon.
continue the discussion at a later date. And best of luck to everyone. Special thanks once again to our guests this evening, counselors and therapists Bruni Emanuel, Meg Doherty, and Kevin Moser. In conclusion, be sure to look for further educational materials so that you can recognize the signs of addiction. There are many community resources available. So if you or someone you know needs help with addiction, please seek help. Callers can call 211, as we all learned tonight, for assistance. Here, all the relevant substance abuse and mental health providers are available. I'm told it's simple and it works. And certainly on a future edition of In Studio, we hope to explore this topic of addiction and how it affects us all even further. It is our intention to share with you a discussion about federal and state legislation and directives, county challenges, the new jail design, reentry services, and much more. But until then, be sure to join Jeff Weeks on our next edition of In Studio. The topic then, Lean In, Women and Achievement. That's in 2 weeks, Thursday evening, March 23rd at 7 p.m. Addiction is a local and national problem, but there are pathways to hope. The experts here tonight and I hope that you will take away something meaningful and helpful from the broadcast this evening. I'm Sherry Hemminghouse Weeks. I'll see you on a future edition of In Studio, or maybe even in your own backyard. Take care.